welcome. Thank you for joining us today. For those of you who are joining us live, you're going to hear a little bit of information about these programs that enable folks in the US to still receive COVID vaccines for free. And we will have time for question and answer, and then we'll also have time for our live participants to discuss your experiences with these programs, maybe any things that have gone really well in your community, challenges that you've experienced helping farm workers and other folks you serve in your community accessing these programs. Please feel free though, even though we're reserving time for questions at the end, if you would like to just jot down a question in the chat as we go, you're more than welcome to do that. Okay. So before we dive into these programs that exist, I wanted to just talk a little bit about, why are we still talking about COVID vaccines, and what is the importance of continuing to promote COVID vaccines in our communities. There's kind of a misperception, I think, that a lot of people have, and that's that a vaccine should stop all illness, and that's really not the goal of vaccines. The goal of pretty much any vaccine is really to reduce severe illnesses, hospitalizations, and deaths. So being vaccinated won't prevent people necessarily from getting sick, but hopefully it will greatly reduce their risk of, being sick for a long time or ending up in the hospital. I'm not going to go into a lot of detail about the different types of COVID vaccines here, but something to mention is that from the fall of 2022 until the fall of 2023, we had bivalent booster vaccines. And that's what we have the most information about how well that vaccine, that booster, is protecting people from hospitalization, severe illness, and death. Right now, just in September of last year, we got a different booster that's been released. It's called a monovalent booster vaccine. And there aren't a lot of sort of real world data about how well that vaccine protects people, but the data that we do have from England and some other places indicates that they're fairly similar in how well they protect people. And so the COVID vaccine it's not perfect, and it's okay to be honest about that. So some of the data that we've seen, some of the research that's been done shows that basically it prevents a lot of hospitalizations, about 62% of hospitalizations in the first 2 months after someone receives the vaccine. And then that protection kind of starts to wane over time. So that's why we're seeing, public health officials encouraging people to be revaccinated, especially right before the holiday season or other times when we're starting to kind of observe these peaks in COVID illness. So who should get vaccinated or who should get boosted is another important question, and it's not entirely straightforward. There's some kind of controversy among scientists and public health practitioners about this, just because, the efficacy of the vaccine isn't perfect, and there's always a trade-off in terms of the cost to the actual administration of the vaccine and sort of people's attitudes towards the vaccine. But generally, it is encouraged for everyone to get the COVID booster, and there is a consensus that certain groups should be really high priority for doing outreach and education to get boosted, especially with this most recent booster. And those groups include the elders in our community, people who are 65 years of age and older. It includes people who are immunocompromised, so their immune systems aren't working as well as they should be, and people who have other chronic medical conditions like diabetes. So basically, these are all factors that, if an elder were to get sick with COVID, they're going to be more likely to end up in the hospital. So we basically get more bang for our buck if people who are at a higher risk of being hospitalized get boosted, and they get boosted regularly. Certainly also anyone who has never received any COVID vaccine, they should be a really high priority for outreach and education efforts for vaccines. And there may be other people too that feel that they need to be boosted regularly, perhaps because they have these types of people in their household. So for example, I might be a young, healthy worker, but I work at a packing house. I'm around other people inside all day, and I have, elders in my home or infants in my home who I want to protect. So all of these people in these groups are going to be where you want to focus your efforts on promoting vaccines. So luckily, we still have free COVID vaccines. I think that people are generally aware, farm workers are generally aware that these programs are available based on the interviews we've done with farm workers recently. But some people may be unaware, and they may have misinformation that now the COVID vaccine costs money. So there's two programs. One is called the Bridge Access Program, and that is for adults. That's a short-term program, and we'll talk a little bit more about that. And then we also have the Vaccines for Children program, which has been around for a long time and hopefully will continue to be around for a long time. All right, thank you, Lisbeth, for dropping that in the chat. So first, let's talk about the Bridge Access Program, which is for adults. And this program is to enable adults who do not have health insurance or adults who have health insurance but would still have to pay some out-of-pocket costs for the vaccine. So this enables people in those groups to still receive a COVID vaccine for free. It doesn't matter if it's their first one or if it's a booster, it will cover any type of dose of COVID vaccine for people in those groups. Your immigration status doesn't matter. H-2A workers can receive this vaccine under this program. Undocumented workers can. It's open to everyone. The catch here is that right now this program will end at the end of this year on December 31st. So we don't know what will happen after that, but at least for this year, there are still free COVID vaccines for adults. You can't get it just anywhere necessarily, but it is pretty easy to access vaccines through this program. So your local health department, your county health department will have vaccines under this program for adults. Health centers, which are sometimes called FQHCs, will also have vaccines under this program. And then major pharmacies also have agreements with the federal government to provide vaccines under this program. And that does include CVS, Walgreens, and eTrue North. People can use the vaccines.gov website as well to find, specifically where they can go in their community to receive these vaccines. The website is fairly user-friendly, but for people that have maybe less experience with technology or low literacy skills, they might benefit from help from an outreach worker or a CHW to navigate that website, but it is pretty straightforward to use. Luckily for this program, there's not like a large paperwork burden. There really isn't any formal enrollment process. So they don't really need to bring, proof of income or anything like that. What may happen is that they might, show up at the CVS to get the vaccine. They'll probably be asked if they have health insurance. If they say no, then they can still receive the free COVID vaccine. If they have health insurance, then the person at the pharmacy is likely going to ask what type of health insurance it is so that they can figure out if the vaccine is covered or not under their program. Okay. For kids, vaccines for kids, this is a program that has been around for a while, and it encompasses, all the required childhood vaccinations, not just COVID-19 vaccines. And this program is across the nation. It's really pretty well known, I think, in many communities. And you'll often see vaccines for kids sites next door or in the same building as WIC sites, which are is the nutrition program for women, infants, and children. So a lot of times it'll be kind of a one-stop shop for people who are seeking nutrition services and vaccines for their kids. The Vaccines for Kids has a bit broader eligibility. So again, this is for children who are uninsured. It's for children who have health insurance, but that health insurance doesn't cover the cost of vaccines. It's also for kids who may be eligible for Medicaid but haven't enrolled. Obviously, if they are enrolled in Medicaid already, they would get vaccines as part of that program. But there may be children who haven't enrolled but would still be eligible for the Vaccines for Kids program. Children who are part of federally recognized tribes are also eligible. Here too, it's broader where you can access this program. So again, it's going to be in your local health department. It will be at health centers, FQHCs, rural health clinics will also administer vaccines under this program. And there are many other providers like school nurses' offices and different types of private and public clinics, hospitals, and even private pediatric offices will administer this vaccine often for kids. So again, you can use that vaccines.gov website to find specific sites in your community that are enrolled in this program. For the vaccines for children, there is an enrollment process. It's not necessarily standardized across the nation, but parents would likely have to complete a form. They might be asked some questions, about if the child has insurance, some questions related to their eligibility for Medicaid. But, under the sort of regulations of this program, the vaccine provider doesn't have to verify all of the parents' answers. So you shouldn't, the people you serve shouldn't be running into a bunch of sort of bureaucratic hurdles in order to access this program. So if they are, talk to us, let us know, because really it should be pretty easy to access. And like Alfonso mentioned, this program is also available to children no matter what their immigration status is. So DACA, undocumented citizens, it's available to everyone. Okay. This is the informational part of the webinar for folks who are viewing this recorded. We would love to hear about your experiences with these programs, with either the Bridge Access Program or the Vaccines for Children program. So if you have any experiences, questions, thoughts you would like to share, you can email us at info@ncfh.org. Thank you for attending.